Hi, thanks for your views and subscriptions. Um, Continuation from the last video. So you are told you are pregnant. There are a few tips you should consider because most ladies tend to ignore them. You have to do an ultrasound and know if the baby or the fetus is in the womb or not. There are some instances that it isn't in the uterus. It stops somewhere along the pathway, most commonly in the tubes. So it ends up giving complications because most people don't do ultrasound, and then it ruptures in the tube, and so they start to bleed profusely. And some instances, it is seen, they are brought to the emergency unit, surgery is done, the tube is cut, and then their life is saved. There are some other instances that people might not know that the person is first of all pregnant, and the person starts to bleed. Some people might even think it's their menstrual period, and then they ignore. So by the time they are taken to the hospital, they become very bad, and some end up dying. So take an ultrasound. It's not difficult to take an ultrasound. Just when you're told you're pregnant, whether you want to keep it or terminate it, please consider taking an ultrasound just to know where it is. Apart from that, there are some pregnancies that are not babies, as in they don't contain fetal tissues. We call them molar pregnancy, but for common knowledge, it's just take it as it doesn't contain any baby tissue. So for such pregnancies, it has to be removed. So first tip, when you're told you're pregnant, kindly just take an ultrasound and please be safe, because then you can, if you want to keep the baby and it's in your womb, you're safe. If it's not in your womb and it's anywhere in your abdomen, in your tube, then something is done about it on time before you lose your life. Please. Thank you for your subscriptions and views. Kindly send me emails if you have any questions. Your critics and recommendations are always welcome. Thank you very much.